Hello everyone and welcome to the Proteus session on specifying patient-reported outcome methods appropriately. The session will focus on the use of the Spirit Pro extension protocol guidance. My name is Mel Calvert and I'm Professor of Outcomes Methodology and Director of the Centre for Patient-Reported Outcomes Research at the University of Birmingham in the UK. And I'm delighted to be co-chairing this session with my good friend and collaborator, Professor Madeline King.
Hello everyone. I'm Professor Emeritus at the University of Sydney in Australia. I'm a specialist in quality of life research and patient-reported outcomes. Thank you for your interest in the Proteus Consortium. This consortium aims to optimise the use of patient-reported outcomes so that they capture the patient's perspective effectively in both clinical trials and clinical practice. In this presentation, we focus on clinical trials. But before going on, I'd just like to acknowledge funding from the Patient-Centred Outcomes Research Institute, or PCORI, and Genentech for the Proteus presentations and resources. Now, Proteus stands for Patient-Reported Outcome Tools, engaging users and stakeholders. And there are a range of tools and resources available, all of which can be found at the Proteus website, which is shown at the bottom of this slide. This slide shows an overview of all of the presentations that are available at the Proteus website. These include 2 introductory presentations and then a series of presentations on these 6 tools, each one of which covers a certain part of the life cycle of a clinical trial's development, conduct, and finally reporting and dissemination. For each one of these tools, there is one presentation at an overview level, and it's relatively short and focused. And there's another presentation about how to apply the tools. And this has more advanced material in it and also includes examples. Now, for today's presentation, we are focusing on the Spirit Pro guidance. And it's all about getting things right at the protocol stage. The other presentations, as you can see, are about which tool how to select the appropriate PRO measure or questionnaire, how to analyze the data appropriately to the trial's PRO specific objectives, how to report and display the trial results appropriately, and how to communicate these results for use in clinical practice. So as I said, today we're focusing on the importance of the protocol. Now, following the Spirit Pro guidance is the first step towards producing high quality PRO evidence. A clinical trial protocol is an absolutely essential document. It describes the science underpinning the study design and the logistics to carry out the trial in an optimal and standardized way across all trial sites, staff, and patients. Now, ideally, the protocol will provide enough detail for the study team to conduct a high quality study. And the detail of that you'll find in the advanced version of this presentation. But today, the presentation you're watching now is a short version. So we will just be going through each of the items quite briefly. This shorter level of detail is very useful for funders and members of scientific and ethics committees who need to appraise the trial's scientific, methodological, and ethical rigour. So has a protocol included everything it should? They don't need to know how to do it. Now, why do we need this? Don't all trials protocols provide that detail? Well, unfortunately, we know from reviews that they don't. Protocols vary greatly in content and quality, and particularly in regard to patient-reported outcomes. Now, getting things right in the protocol is a terrific start, but things can still go wrong during trial conduct, analysis, and reporting. So the other Proteus presentations that covered these will also be valuable valuable presentations and resources for you to look at. So let me say briefly why the Spirit Pro guidance is needed. It's to ensure that critical aspects of the PRO sub-study are included in the trial protocol, and those are needed there then for successful conduct. So what does it do? It recommends items to address in clinical trial protocols where PROs are primary or key secondary outcomes. I'd like to draw your attention to a key manuscript. This is one that Professor Calvert and I co-wrote together with our team, and it describes the process we went through to develop the Spirit Pro extension, and it gives a list of the items that are recommended for inclusion. In doing this, a lot of other people were involved. In addition to the group executive, and you can see their names there, and we were the writing team as well, there were also the broader group members. And we'd like to thank all of those people for dedicating their expertise and time. And this was absolutely essential to achieving a robust consensus process. We'd also like to acknowledge the assistance and support of the ISOQOL Protocol Checklist Task Force and ISOQOL members who completed the stakeholder survey. In addition to those, there were other organisations and companies who provided support, either funding or in-kind support. And we thank all of those people and organisations as well. So I'd like to hand over now to Professor Calvert, and she'll start going into what those items are, but starting off with first, why do we even need them? Thanks, Mel.
Thanks, Professor King. So why do we need a Spirit Pro extension? Well, we know that protocol quality can be poor, and as a result, the data quality is variable. We believe that this leads to suboptimal reporting of PRO data, and this can prevent or hinder uptake of this valuable information in practice. The Spirit 2013, the Standard Protocol Items Recommendations for Interventional Trials Guidance, is a really valuable resource, but it does not provide pro-specific guidance, and hence the need for us to develop this tool. So the objective of the resource was to provide international consensus-based pro-specific protocol guidance in the form of an official Spirit Pro extension. The resource was rigorously developed with international stakeholder involvement. This comprised of a systematic review of existing PRO-specific protocol items, work with the International Society of Quality of Life Research Protocol Checklist Task Force to review those items and develop an international stakeholder survey and also a Delphi survey. This information was then used to inform discussions at an international consensus meeting and to develop the final Spirit Pro extension. The Spirit Pro protocol guidance is to be used in conjunction with the Spirit 2013 statement and other related extensions as appropriate for your trial. It comprises of 5 elaborations to the existing Spirit 2013 checklist items as applied to PROs in randomised clinical trial protocols. It also includes 11 extensions, which are additional PRO-specific items which are recommended for RCT protocols where patient-reported outcomes are a primary or important secondary outcome. So I'm now going to talk through each of the sections within the protocol in turn. And we're going to start with the administrative information and introduction. So the first Spirit item, 5A, is focused on roles and responsibilities and including names and affiliations of the protocol contributors. The PRO Elaboration 2018 stated that you should specify the individual that's responsible for the PRO content of the trial protocol. This aims to promote transparency and accountability, and will also identify an appropriate point of contact for resolution of any PRO-specific queries. It's also really important to document when patients have actively contributed to the protocol development. Spirit item 6A is focused on the background and rationale. Spirit 2013 states that you should describe the research question and the justification for undertaking the trial and a summary of results. The PRO extension states that you should describe the PRO-specific research question and rationale for PRO assessment and summarise PRO findings from relevant studies. This is important as it will help select measures and specify hypotheses and analyses. Crucially, it will also help staff and patients understand why the PROs are being assessed, and that can help reduce missing data in your study. Also, when PROs are a secondary outcome, a brief rationale may be adequate. Spirit item 7 focuses on objectives. Spirit 2013 stated that you should specify the objectives or hypotheses. And the Spirit PRO extension states that you should specify the PRO objectives or hypotheses, but including, crucially, relevant PRO concepts and domains. This will encourage identification of key PRO domains and time points, reducing the risk of multiple statistical testing and selective reporting of PROs based on statistically significant results. We will now move on to the methods section and consider participants, interventions and outcomes. Spirit item 10 focuses on the eligibility criteria. Spirit 2013 stated that you should have clearly specified inclusion and exclusion criteria for participants, whilst the PRO extension states that you should specify any PRO-specific eligibility criteria, such as language, reading requirements, or pre-randomization completion of the PRO. It's also important to note that if the PRO is not going to be collected in the entire study sample, that you should provide a rationale and describe the method for obtaining the PRO subsample. Now, in some trials, it might not be possible to collect PROs in the entire population, such as when validated questionnaires are not available in all languages. And in large trials, you may have sufficient power to be achieved by collecting PROs from a subset of the participants. So that's why it's really important that you specify this in your eligibility criteria. Spirit item 12 is focused on outcomes. Now, Spirit 2013 stated that the primary, secondary and other outcomes, including the specific measurement variable, analysis metric and method of aggregation and time point, should be stated for each outcome. The PRO extension states that you should specify the PRO concepts and domains used to evaluate the intervention. So, for example, the overall quality of health-related quality of life, a specific domain such as physical functioning, or a specific symptom. For each of these, you should specify the analysis metric. So, for example, this could be change from baseline, a final value or a time to event, and the principal time point or period of interest. Again, this will reduce the risk of multiple statistical testing, and these should closely align with the trial objectives and hypotheses. Spirit item 13 is focused on the participant timeline. Spirit 2013 states that you should have the schedule of enrolments and interventions, assessments and visits for participants, and you should ideally include a schematic diagram. The PRO extension states that you should include a schedule of PRO assessments and have a clear rationale for the time points for assessment. You should also justify if the initial assessment is not pre-randomization, as this could potentially bias results. You should clearly specify time windows for the PRO collection and whether the PRO should be collected prior to clinical assessments. And if you're using multiple questionnaires, whether the order of administration is to be standardised. This schedule of assessment is really crucial as it helps staff understand when the assessments need to take place and may help reduce missing data. Pre-randomization assessment will help ensure unbiased baseline assessment, and if it's an eligibility criteria, it can help ensure data completeness. Having pre-specified time windows will help ensure that the PROs capture the effect of the clinical events of interest. Spirit item 14 is focused on sample size. The Spirit statement focuses on estimating the number of participants needed to achieve study objectives and how it was determined, including clinical and statistical assumptions supporting the sample size calculation. The Spirit PRO Elaboration states that where a PRO is the primary endpoint, you should state the required sample size and how it is determined, and also the recruitment target accounting for expected loss to follow-up. If, however, the sample size is not established based on the PRO endpoint, then you should discuss the power of the principal PRO analyses. In terms of the explanation for this, well, if PROs are the primary endpoint, ideally you should specify the criteria for clinical significance, for example, minimal important difference if known. But if they're secondary endpoints, then you really need to understand whether you'll have sufficient power to test the principal PRO hypotheses within your trial. We'll now turn to the next section, which again is methods, but focused on data collection, management, and analyses. Spirit item 18A focuses on data collection methods. The Spirit 2013 statement focused on the plans for assessment and collection of outcome baseline and other trial data, including any related processes to promote data quality, a description of the study instruments, and reference to where data collection forms can be found if not in the protocol. There are 4 PRO extensions that relate to this, which I'll talk through in turn. The first Spirit item 18A is focused on justifying the PRO instrument, describing the domains, the number of items, the recall period, instrument scaling and scoring, and indicating the range and direction of the scores. You should also provide evidence of the PRO instrument measurement properties, interpretation guidelines, and patient acceptability and burden, ideally in the population of interest, and state whether the measure will be used in accordance with any user manuals and if justify any deviations. The selection of PRO questionnaires does require careful consideration, and there are a large number that you can select from. You need to consider the patient burden and acceptability. And crucially, questionnaires should be used in accordance with any existing user manuals to promote data quality and ensure standardized scoring. The second item relating to 18A is to include a data collection plan outlining the permitted modes of administration, for example, paper, telephone, electronic, or other, and also the setting where the PRO data will be collected. This could be, for example, in clinic, in the patient's own home, or other. So this is really important because the research personnel and trial participants need to know how, when, and where the PRO data will be collected. The setting for PRO data collection should be described and standardized across trial intervention groups and sites. And if you're using electronic PRO measures that contain any minor modifications with respect to the paper-based versions, usability testing and cognitive debriefing may provide sufficient evidence of equivalence. The third item relating to Spirit 18A is to specify whether more than one language version will be used. You should state whether translated versions have been developed using currently recommended methods. So trials involving participants with different languages require measures that have been translated and culturally adapted using appropriate methodology. This may influence the selection of the measure to be used, because inclusion of a wide range of participants can help ensure the generalizability of trial results. The fourth item relating to Spirit 18A is when the trial context requires someone other than the trial participant to answer on their behalf a proxy reported outcome, that you should state and justify this. You should provide and cite evidence of the validity of the proxy assessment if this is available. So this is particularly important in some contexts, for example, trials involving young children or cognitively impaired participants, as it may be necessary for someone other than a trial participant to respond on that participant's behalf. Clearly justifying and specifying the proxy reporting in the protocol will allow external reviewers to assess potential bias and facilitate trial reporting in accordance with Consort Pro. I will now hand over to Professor King to go through the remaining items. Thank you, Professor King.
Thanks very much, Prof. Calvert. I am starting now with item 18B, which continues with data collection methods. And the Spirit Pro guidance talks about participant retention and completeness of follow-up, and also about participants who discontinue or deviate from the intervention protocol. And this item has one PRO extension and one PRO elaboration. The PRO extension talks about the need to specify PRO data collection and management strategies for minimising avoidable missing data. Now, the explanation for this hinges on the fact that missing data are particularly problematic for PROs for three reasons. First, unlike many other types of data in clinical trials, PRO data cannot be obtained retrospectively. So if you miss it at a planned assessment, it remains missing forever. Second, once you have missing data in your data set, then you effectively reduce the sample size and hence the power for the PRO analyses. And third, and most worryingly, it's a potential source of bias. Why? Because participants with the poorest outcomes are often those who do not complete the planned PRO assessments. So I just wanted to finish by noting that not all missing PRO data are avoidable. Patients, of course, have the right to decide not to complete their questionnaires, for example, if they're feeling too unwell, and obviously deceased patients cannot complete. And this is why strategies are needed to avoid and manage those other reasons for missing data, which typically are oversight and errors. These are things that you can control with careful planning and management. The second PRO item relating to Spirit item 18B is an elaboration. And it says, describe the process of PRO assessment for participants who discontinue or deviate from their assigned intervention protocol. Now, the reason for this is that it ensures that staff collect all the PRO data required and no more after that discontinuation or deviation has occurred, and do it in a standardised and timely way. This in turn helps minimise bias, and it may also assist with ethical appraisal because of the ethical issues around discontinuation and deviation from intervention protocol. The next item is item 20A, and it relates to statistical methods. Spirit 2013 requires that statistical methods for analysing primary and secondary outcomes are stated, and if details are not available in the protocol, then a reference to where other details such as a statistical analysis plan can be found. The PRO elaboration on this is to state the PRO analysis methods, and particularly those for addressing multiplicity or type 1 errors. Now, these arise because typically when you assess PROs, there are several different domains and time points, and these imply multiple hypothesis testing, which in turn inflates the probability of false positive findings, and these are the type 1 errors. So pre-specifying your key PRO domains and time points helps, and note that this relates back to item 12. So protocols should either fully address these issues or summarise them or provide a summary version of them and refer to where details can be found, typically in a statistical analysis plan. And there may even be a specific SAP for the PROs. Item 20C, also statistical methods. This one is about defining the analysis population in relation to protocol non-adherence. Now, how this relates to PROs is all around that handling of missing data. So the PRO elaboration is about to state how missing data will be described and outline the methods for handling missing data, or entire assessments, in fact, and to describe the approach may be imputation or sensitivity analyses. The explanation here relates to the fact that there are two levels of missing PRO data. Sometimes items within a questionnaire are missed, and it's important to state as part of your statistical analysis plan whether and how these items will be imputed. This is typically stated already in the instrument scoring algorithm, so that's where you find that information. The other level is actually the much more important level in terms of missing data, and that's where an entire PRO assessment has been missed. And this is the type of missing data that leads to major potential bias. So any form of analysis of PRO, longitudinal PRO data will make some sort of assumption about why those data were missing. That's called the missing data mechanism. And this should also be stated in your protocol. So now moving on to protocol section about monitoring. And this then refers to item 22, or harms, and the Spirit 2013 guidance talks about plans for collecting, assessing and reporting and managing adverse events and other unintended effects of the trial. Now, in the case of PROs, this relates to whether or not the PRO data will be monitored during the study to inform the clinical care of trial participants. And this needs to be stated in the protocol. Now, if the data are going to be used to monitor patients, then this needs, you need to explain how this will be managed in a standardized way and describe how this process will be explained to participants, for example, in the information sheet and consent form. Now, the explanation around this relates to patients' safety and participant safety, because PRO data may be monitored during a study for signs of psychological distress or physical symptoms that may require an immediate response. These are sometimes called PRO alerts. And it's very important to monitor and manage these in a standardized way to minimize potential bias. And also alternative support mechanisms for patients should also be outlined if explicit monitoring is not going to be used. So that finishes all of the Spirit Pro items. And now we'll move on to the implications of using Spirit Pro guidance. And this can have multiple benefits. For protocol writers, it can encourage and help careful planning of the PRO components of the trial, and in doing that, improve the PRO aspects of the trial design. For people who are reviewing protocols, so people on scientific and ethics committees, and also patient partners, it can help them, give them a structure for assessing whether all the important elements related to PROs have been addressed and how they've been addressed. And for trial staff and participants, it helps them to understand the rationale for the PRO assessment. And in doing that, it may actually improve the PRO data completeness and quality. Now, all of these things together will in turn facilitate high quality analysis and reporting, and ultimately improve the quality of the global PRO evidence base. So just to recap, why is the Spirit Pro checklist needed? Because the PRO content of protocols is often incomplete and inconsistent. And what does the Spirit Pro checklist do? It supplements the standard Spirit guidelines for writing RCT protocols by recommending 16 items to be included in all RCT protocols where PROs are either a primary or an important secondary outcome. And if used, this will ensure critical aspects of the PRO study are included in the protocol, which in turn will lead to high quality PRO data and evidence. But implementation is absolutely the key. And by following these recommendations, we can improve the quality and completeness of PRO content in protocols. So here's a list of additional reading if in case you would like to delve further into any of these issues that have been covered in this presentation. And I also remind you that for a more advanced version of this presentation, please revisit the Proteus website. So thank you very much for your attention, and Professor Calvert and I hope that you have found this presentation useful, and we wish you all the best in your work with patient-reported outcomes. Thank you.